This year, 2 Henry Ford Medical Group physicians are marking a major milestone, 50 years with Henry Ford. That's Dr. Riyad Farah and Dr. Ghaus Malik from their current Henry Ford photos. And here they are when they were just a little bit younger. Dr. Farah began his career as a resident at Henry Ford Hospital in 1970. Since then, he's dedicated his professional life to advancing the field of urology, publishing scores of journal articles, and receiving many awards and accolades. He's served as an active member of the Henry Ford Hospital Medical Association Executive Committee since 1983. When Dr. Ghaus Malik came to Henry Ford as a resident 50 years ago, he planned to return to Pakistan once he was done training in neurosurgery. But he tells me fate and a couple of mentors stepped in along the way.
The first day was July 1, 1970. I remember at that time there were only 84 program places that offered training in neurosurgery.
And there was only one Dr. Robert Knighton, the mentor seen here in the middle, who urged Malik to stay in Detroit once he finished his training.
I felt an honor to be asked by my chairman to actually join the department and be part of the faculty at Henry Ford, which offered not only just the practice opportunity, but offered educational opportunity, training residents, as well as research opportunities.
Over the years, Malik has trained more than 75 neurosurgeons, not including the dozen or so currently in residency at Henry Ford.
The favorite is when you see young people come in who are not exposed to that discipline, and you provide them the opportunity to learn not only just the science of it, but the practice of it, the ethics of it, the patient-doctor relationships. Those are very, very critical issues.
Malik would also team up with another chairman of neurosurgery, James Ausman, to advance neurosurgery around the world, often traveling in every corner of the globe to teach. Malik is noted for treatment of cerebral aneurysms, arteriovenous malformations, and complex tumors. That has brought patients from every part of the world to his operating rooms at Henry Ford Hospital and Henry Ford West Bloomfield Hospital.
The first person coming in here was from Argentina. It was a physician who had a very complex blood vessel malformation.
I asked Malik what stands out when he looks back on his time with Henry Ford Medical Group.
I think the character of the institution really stands out. Be able to collaborate with the rest of the physicians for the care of patients, getting consultations, getting advice, getting the support, and similarly providing that support to the other physicians.
As they have for 50 years, his colleagues can continue to count on his support, and his patients can count on his expertise.
You know, people ask me, patients ask me, and so forth, Doc, you're not going to retire? And my standard answer is, I haven't thought about it, and no one has suggested to me.
Dr. Malik has been recognized with a number of awards and honors. He's a member of the Society of Neurological Surgeons, and he received the Henry Ford Medical Association's Lifetime Achievement Award. Not to mention, all 3 of his children, plus a daughter-in-law, have worked alongside him at Henry Ford West Bloomfield Hospital.